Trichotillomania is also known as TTM, trich, hair pulling disorder, or compulsive hair plucking. People with trichotillomania experience repeated impulses to pull their hair out, which they find really difficult to resist. The urge to pull out the hair leads to tension, which increases in intensity and is finally relieved when a person plucks out a hair. However, some individuals may pull out their hair without even thinking about it, and others may pull out their hair in response to stress. The most common method of pulling out hair is with the hands, although tweezers or other instruments may be used. People may pluck their hair out at long periods infrequently or shorter periods more regularly. The most common place people pluck their hair from is the scalp, the eyebrows or the eyelids, although hair may be pulled from any area of the body where it is present. In an individual, they may pull out their hair at different sites of their body at different times. The pulling out of hair on the scalp may lead to unusual shapes of baldness, and there may be less hair on one side of the head than the other. People may try to conceal their hair loss by wearing scarves or hats, false eyelashes, or by tattooing eyebrows onto their face. Some people may chew or swallow their hair, and this may lead to dental or digestive problems. Trichotillomania causes significant distress and can affect every aspect of a person's life. They may have such a sense of shame and low self-esteem that they don't tell anybody about their condition. Trichotillomania is more common in girls than boys, with a ratio of 10:1, and tends to present around puberty and early adult years. It may last for months or years if untreated, and in women may become especially worse during the perimenopause. The usual course of trichotillomania is chronic, and the hair pulling may come and go for weeks, months or years at a time. In a minority of individuals, the hair pulling may cease within a few years of onset. The term trichotillomania was coined by the French dermatologist François-Henri Hollipeau in 1889. He combined three Greek words, trich, hair, tillein, pulling, and mania, madness. It was first recognised as a mental disorder by the American Psychiatric Association in 1987. In ICD-10, trichotillomania comes under the subcategory habit and impulse disorders, under the main category of disorders of adult personality and behaviour. Other disorders that come under the heading habit and impulse disorders include pathological gambling, pathological fire setting or pyromania, and pathological stealing, kleptomania. ICD-10 describes trichotillomania as follows, and I quote, "A disorder characterised by noticeable hair loss due to a recurrent failure to resist impulses to pull out hairs. The hair pulling is usually preceded by mounting tension and is followed by a sense of relief or gratification. This diagnosis should not be made if there is a pre-existing inflammation of the scalp or if the hair pulling is in response to a delusion or hallucination." In ICD-11, in use from 1st of January this year, it comes under the heading Body-Focused Repetitive Behaviour Disorders, which sits under the category of obsessive, compulsive or related disorders. The treatment for trichotillomania is very similar to that for obsessive compulsive disorder and is cognitive behaviour therapy. An additional element of the therapy for trichotillomania is called habit reversal training. This works by allowing the person to become more aware of their hair pulling and the things that might trigger it, and to get them to swap the hair pulling for a less harmful behaviour. It means that the person will need to tolerate the discomfort of avoiding pulling out their hair. Medication is no longer considered to be effective in trichotillomania, although if the person also has depression, and this may even be caused by the trichotillomania, then antidepressants will help the depression. Thank you for listening. Bye for now.